My name is Martha Ellison, and I've been asked to make this video to discuss why healthcare reform is needed based upon my own personal experience with a medical situation. Fortunately for me, my situation was not as bad as it could have been. I had fairly good health insurance, and so I was, and with other situations, the medical expenses did not wipe me out financially. However, let me, getting ahead of myself, let me back up and tell you my story. 6 years ago, I was hospitalized for 5 days for complications from the flu. During that hospitalization, an IV was inserted and remained in that same site for the entire 5 days. I did not realize at the time that that IV should have been moved to another site within every 36 hours. I believe it was 36. That was not done. As a result of that, upon discharge, I noticed that the site looked like it was infected. However, the nurse that took out the IV upon my discharge did not make any mention of the site looking infected. So I was discharged home, and within 24 hours I was readmitted to the hospital. I had developed a staph infection in that wound, or in that site, also blood clots in my arm. As a result, during that second hospitalization, I was hospitalized for 40 days, underwent 2 surgeries, was on IV antibiotics the entire time of hospitalization, spent 3 days in intensive care, also was transferred at the end of my acute hospital stay to an extended care facility for approximately a week and a half because I was still on the IV antibiotics. Fortunately for me, the hospital admitted to their mistake and agreed to pay the medical expenses during my hospitalization, the extended care, the surgical expenses, all of the various doctors that I had to, that I was seen by during my hospitalization. And also, as I said, I had insurance. The hospital also agreed to continue paying for ongoing medical expenses after my discharge because I had to be followed by a pulmonary specialist because the staph infection had traveled to my lungs, and there was damage that was done to my lungs that had to be monitored, which required numerous CAT scans. I was post-discharge from the extended care facility. I was off work for another month and a half. Fortunately, I had enough sick leave to carry me through. But the hospital did agree, if I ran out of sick leave, that they would pay my salary during that period of time. So as you can see, I was fortunate. If I had not had that coverage and the hospital had not admitted their mistake and been willing to pay those expenses, I would have been wiped out financially, no doubt about it. Even with my insurance, if the hospital had not agreed to pay the expenses, I would have I would still be in debt today. And as I said, that occurred 6 years ago. Now, as I said, I'm fortunate. Things worked out. I did not face financial hardship as a result of this medical experience. However, 45 million people in the United States are not as fortunate as I am. And if they face something like I did, or a cancer diagnosis, or a stroke, or heart attack, or kidney failure, or whatever, with no insurance coverage, they will be wiped out financially due to those expenses. Even with insurance coverage, many people end up in debt. It's difficult enough to deal with a medical situation. It's emotionally difficult. But to, on top of that, have to worry about the finances is unconscionable. We need health care reform. The citizens of this country need to be able to receive appropriate medical care. It needs to be accessible, needs to be affordable. Health care in this country now is more of a privilege than it is a right. And in reality, it should be a human right, not a privilege. People should not have to sacrifice their financial future because of medical need. I ask you to work on health care reform that will make health care a right for every citizen, that will be comprehensive, that will be accessible, and that will be affordable. As I said, my name is Martha. I'm from Barberville, Kentucky, and we need health care reform now. Thank you.